Hello and welcome. My name is Heidi Lang, and if we've not had the pleasure of meeting before, I serve as the Pre-Health Professions Advisor here at Saginaw Valley State University. On behalf of President Bashand and Provost Huntley, we are delighted to welcome you this evening to our campus, both in person and virtually, for Dr. Mona Hanna-Attisha's lecture, What the Eyes Don't See. We will hold a Q&A session at the end of the lecture. Tonight's event is part of the Your Health Lecture Series and highlights our partnership with Michigan State University's College of Human Medicine and Mid-Michigan Health in Midland. We are grateful for these collaborative relationships and the phenomenal opportunities we can bring to our campus and our students. Tonight's event is also made possible through a grant from the SVSU Foundation Office. So to our partners in the audience and online tonight, we thank you. In a few moments, we will welcome to the stage Dr. Mona Hanna-Attisha, or Dr. Mona, as she is affectionately called by her patients. Dr. Mona is founder and director of the MSU and Hurley Children's Hospital Pediatric Public Health Initiative, an innovative and model public health program in Flint. A pediatrician, scientist, activist, and author, Dr. Mona has testified 4 times before the United States Congress and was awarded the Freedom of Expression Courage Award by PEN America. She was named one of Time Magazine's 100 most influential people in the world and recognized as one of USA Today's Women of the Century for her role in uncovering the Flint water crisis and leading the recovery efforts. She most recently received the 2020 CDC Foundation Prize for improving health. She is the founding donor of the Flint Child Health and Development Fund, Flint Kids, a fund that several students in the audience worked to raise $1,000 for in advance of Dr. Mona's visit to campus today. Dr. Mona completed her medical degree from Michigan State University, College of Human Medicine, and her residency at Children's Hospital of Michigan in Detroit. She is currently a Charles Stewart Mott Endowed Professor of Public Health and an Associate Professor of Pediatrics and Human Development at MSU's College of Human Medicine. Please join me in a warm welcome to Dr. Mona Hanna-Attisha as she comes to the stage.
That was a socially distanced hug. All right, I am totally blind with these bright lights, but I am so excited to be here with all of you today. Thank you to the president, thank you to the provost, thank you to everybody at Saginaw Valley. Thank you to Michigan State University College of Human Medicine. This event has been literally, I think, almost 2+ years in the planning, right, Heidi? We've been working on this a long time. We thought maybe we should just transition to Zoom or virtual, but there is nothing like being together in person. I am a people person. I am, sorry, they told me I could take my mask off. But look, you can still talk with a mask. I love to be, I just love to kind of gauge the energy and to be with everybody here. So it's wonderful to be here after about 1.5 years of being stuck at home or seeing patients in clinic. It's so wonderful to come back and to see people again. Somebody said the return to the familiar, return to normal. We don't know what's gonna happen, but it's still, once again, just so wonderful to be together with friends. So I'm so excited to talk to you. I'm so excited to share my story with you. It is a story of crisis. It is a story of resistance, and it is a story of hope. And I will talk for about, I don't know, maybe 30-ish, 20 to 30 minutes. But the beauty of these conversations are when we are in dialogue. So as I am talking, think of questions about anything that I talk about or don't talk about. I know a lot of folks out there have read my book. So if there's something from the book or about writing a book or about being an author or about the work today or about Benton Harbor, like there's a lot that we can talk about. So think of those questions during this conversation. So I kind of want to start at the very, very beginning. It's hard to tell this story, but it's really hard to tell any story without going backwards. So if you've read my book, you know that I am a huge fan of history. I was always taught as a student, it's something that I try to ingrain in my students, that if you truly want to understand kind of where we are, and if you want to understand how we go forward and find solutions to things, we have to start by looking back. We have to rewind. We have to kind of appreciate the history. We literally step over history every single day. It shapes our present. So let's kind of go back and go back to Flint history. Because if you understand that history, you literally could have predicted our crisis. So you guys tell me, and I know you all, any Flintstones in the audience? Any Flint kids? There's always Flint kids. All right, we got at least one Flint kid. Okay, you guys tell me, what was Flint famous for a long time ago? Cars, right? Flint was the birthplace of General Motors. Cars were born in Flint. And this is a little harder and maybe extra credit, but I think for sure somebody will know this. What else is Flint famous for that happened shortly after cars were being made? Who said that? Okay, you win. Okay, the middle class. So yes, so shortly after cars were coming off those assembly lines, the workers in Flint in the 1930s, they're like, hey, like this company is making a lot of money, but like we're working really hard. And on the days that we make blue cars, we're like coughing up blue. And the days we make red cars, we're coughing up red, and like we're losing fingers and they don't care. And they're like, this isn't right. Like, prosperity is happening only for the industry, for the corporation. So they did something crazy, and they did something radical, and they did something illegal and totally disobedient. The auto workers on Flint went on strike, and they went on strike, and it was known as the strike that was heard around the world. It was a sit-down strike, so they sat down, and they occupied the car plants in Flint for 44 days. And it was cold. It was like December, January, Michigan winter. They cut the heat. There was like beatings. There was all these kind of, thugs came in to try to take their jobs. And they persisted. They're like, no, we want living wages. We want occupational health and safety. We want to be like treated okay when we go to work. We want benefits. We want housing and healthcare and all these things that we kind of take for granted now. But if you think about it, things that workers are still fighting for to this day. And something crazy happened after 44 days. The governor of Michigan at that time, and President Roosevelt intervened, and they called in the National Guard. And it was actually the last time the National Guard was called in before the water crisis. Somebody's calling me. Stop calling me. Sorry. That's a crazy thing with these phones. Okay. So they called in the National Guard, and the governor and the president called them in to actually protect the auto workers, which was amazing. And they not only protected the auto workers, they recognized for the very first time their union. Do you guys know what union that was? The United Auto Workers, the UAW. The UAW was born, and the deal that came about was something called the Grand Bargain. And it was a grand bargain. And they got those living wages, and they got things like pensions and healthcare and benefits and great infrastructure and great schools. And Flint literally became this promised land. Immigrants from all over the world came to Flint for that prosperity. African Americans fleeing the oppression and the racism of Jim Crow South came up to Flint like they did to many northern cities, especially around the 1950s. And that grand bargain that was established in Flint literally birthed the middle class. The middle class in America was born in Flint. The very subdivision in America, first subdivision in America, was in Flint. And not only did it benefit Flint, that bargain informed wages across the country, and it lifted people up. And you're like, why is she talking about this? She's a doctor. Like, why is this history all so important? It is absolutely important, because not only did people in Flint have some of the highest wages, and this is really hard to believe, in the 1980s, Flint had the highest per capita income in the country. Like, that's crazy. That wasn't that long ago that the people of Flint made some of the most money than any other city in the country. And now we are the poorest city of our size. And with that income, and that economic prosperity came improved health. At the same time, the people of Flint had some of the best public health indices. So Flint was this place of prosperity for a long time. Once again, the birthplace of cars and the birthplace of the middle class. And you guys tell me, what happened after that? Manufacturing left, right? So a lot of people ask, like when I say what's Flint famous for, they say Roger and Me, the Michael Moore's first documentary, which is now like almost 30 years old. So plants closed, jobs were lost. People who had the power and the privilege to leave the city left the city. So the things that became, epidemic in Flint were things like poverty and unemployment and violence. And that put Flint kind of on the bad end of every list. That put Flint in a state of crisis, literally for decades. Every disparity you can think of, from asthma to infant mortality to decreased life expectancy. A kid that I care for in Flint will actually live 20 years less than a kid in another part of our county, same county, Genesee County. There's a 20-year difference in a kid's life expectancy. Is that okay? No, that's not okay. Where you end up should not be predicted by where you grow up. Yet, throughout this nation, in too many places, and once again, not unique to Flint, this is a situation, especially for so many of our children. So Flint, because of kind of the loss of manufacturing due to many reasons, outsourcing and automation, the list goes on, but really based on decisions, based on greed and a lot of racist decisions that with real estate practices and cuts to revenue sharing, and the list goes on, that made Flint this hyper-segregated, very poor city. At one point, Flint had a population of, I think over 200,000 people. At one point, Flint employed about 80,000 people just in General Motors. And in 2014, I think, Flint had a population of 90,000 with like maybe 5,000 to 8,000 GM workers. So it is a story not unlike so many stories in this country of disinvestment, and that impacts health. That impacts what happens to our children and once again to their trajectories. So you guys tell me, so Flint was in a state of crisis. It was, had all these socioeconomic conditions for a long time. It was near bankrupt as a city. So what happened to Flint in 2011 because it was in this kind of near bankrupt state? You get extra credit. So Flint was assigned an emergency manager. So we're going to talk about this a little bit. So do you guys remember the emergency manager law? So at one point in Michigan, we had emergency managers running a lot of our cities. At one point, about half of our African American population in the state of Michigan was actually under emergency management, compared to just 2% of our white population. So does anybody know, this is fun, like the interaction is fun, you guys having fun? Okay, so, so the emergency manager law, so let's rewind on that a little bit. So do you guys know that the state of Michigan, there was a ballot proposal about the emergency management law, and the people of Michigan said, we actually don't want this emergency manager law. So the state of Michigan, the people of Michigan voted down emergency managers, the law, how the state can take over cities. But then it got tweaked in our legislature. It was modified a little bit, despite the will of the people, and it was passed and it was signed by the governor. So kind of the history of the emergency manager law is that it was actually done against what the people of Michigan wanted. And what's most bizarre about the emergency manager law is that it took away democracy. And I want to reiterate how kind of this Flint story is not just this water story or this sign story or this doctor who spoke up story. It's also very much a democracy story, because, here were these unelected, unaccountable officials appointed by the governor who had kind of one job, and that job was austerity, which means to save money. It was cut costs, cut costs, cut costs. And in Detroit, there was an emergency manager, and they were trying to sell off the DIA, the Detroit Institute of Arts, at one point. But the people were like, no, you can't sell the DIA, and lots of folks intervened. But Detroit kind of got the A team of emergency managers, and Flint kind of got the B team of emergency managers. And they were trying all different things, different ideas to kind of save money. At one point, my hospital, Hurley Hospital, they were about to sell Hurley Hospital. Unfortunately, that didn't happen. But they decided, what are we going to do for this predominantly poor city, that's bankrupt because the tax base is gone, they can't support themselves? Like, how else are we going to save money? So what was their brilliant idea on how to save money? Change the water. Because Flint, for half a century, was buying its water from Detroit. And they're like, we don't want to pay Detroit anymore. Let's just draw our own water from the Flint River until we can build a new pipeline to the Great Lakes. So, we can't have a talk without bringing out the mitten, right? So Michigan, right? So what are we surrounded by, guys? Lakes. And the Great Lakes are the largest source of fresh water in the world. 21% of the fresh water in the world is around Michigan. Isn't it amazing? Like, we are so lucky. And here's Flint, and here's you guys. So we're close, we're neighbors. So we are surrounded by the Great Lakes, and for half a century, we were getting our water from Lake Huron that we bought from Detroit. High quality Great Lakes water that Detroit, processed and treated and sent it up to Flint. And once it came to Flint, maybe we added a little bit of chlorine, a little bit of disinfectant, and sent it off on its way. But these emergency managers were like, wait a minute, this is too expensive. This fresh water is now too expensive for this predominantly poor, minority community. So in April of 2014, and you might remember seeing kind of footage of this, lots of men in suits pressed a button, and our water source was changed, and they held up glasses of water to toast our switch to Flint River water. So I just want to reiterate once again that this is a democracy story. This is what happens when we lose representation, when we lose voices at the table. And a lot of you are like, oh, this is crazy. That was just this crazy thing that happened over in that one city. That can't happen everywhere else. And one of the reasons I wrote this book, and one of the reasons I'm trying to reiterate this now is, there's today efforts where democracy is trying to be usurped, be it with voter suppression laws or voter ID laws or gerrymandering or mass incarceration. The list goes on. There are ongoing efforts to try to take away power from majority-minority communities. And it hurts, it makes people sick. And let kind of Flint serve as an example of the consequences of taking away, corroding democracy. So our water source was switched in April 2014, and it was fine, right? And I'm gonna go home, no? Okay, so no, it wasn't fine. So there was problems right away, and during this time, I was a pediatrician in Flint, still a pediatrician in Flint. I'm in clinic tomorrow, all day, still seeing patients. I was the residency director, so I was in charge of kind of the training of future pediatricians. So all of my clinical kind of care was with learners, with med students and residents, and seeing patients throughout this time. And patients were coming in and they're like, my water is like greenish and yellowish and brownish. Do you think that's okay? Or they'd ask, my baby's on formula, and you make formula. How do you guys make formula? You mix powder with water. And they're like, are you sure I should be mixing my baby's formula with tap water? Like, I know all the folks in charge are saying it's okay, but like, are you sure it's okay? Or, you know, we are trying to not have kids drink a lot of soda and pop and juices because it's contributing to childhood obesity. And they're like, are you sure I shouldn't give my kid pop or juice? Like, are you sure I should be giving my kid water? Because like, it's weird, the water is weird. Whenever I bathe my baby, and when I put them in the bath, they get a rash right to the water line. Is that okay? And for about 1.5 years as a pediatrician in Flint, I was telling my patients that the water was okay, because like going through my head, I'm like, wait a minute, like we're in the middle of the Great Lakes, like how can our water not be okay? Like we're literally like in the middle of fresh water. And then also going through my head is like, this is America? Like this is the richest country in the history of the world. Like how could our water not be okay? And then I was also thinking like, wait a minute, it's the 21st century. Like we have come a long way on our ability to deliver safe drinking water. Like civilizations are literally built on the delivery and the sanitation of drinking water. So all those things were going through my head. But then also I was thinking like, wait a minute, there's rules and there's laws. And there's people that our tax dollars pay that go to work to make sure, and if we live in Flint or Saginaw or Detroit, that when we turn on our tap, our water is safe, right? Like, and I pictured them in my head. I pictured them with like lab coats and test tubes and checking to make sure that our water was okay. Like, isn't that part of public health? And like, there's people, there's laws, you know? So those were things that were going through my head when I was reassuring my patients for too long that the water was safe. But you guys all know that it wasn't. There was problems really from the onset. It was, like I said, color and odor and taste and bacteria. And to treat the bacteria in the water, they added a lot of chlorine, which is important. It's a disinfectant. But they added so much chlorine that families are like, I feel like I'm drinking a glass of bleach. And when I take a shower, it's like I'm in a swimming pool. There was so much chlorine in our water that we had a buildup of a chlorine byproduct, something called total trihalomethanes. You can't even say it. TTHMs, which are carcinogens. They cause cancer. So lots of problems. And I think kind of for me, the most glaring red flag happened just a few months after our water switched. Water switched in April. This was around the fall when General Motors, born in Flint, still has some plants in Flint, and they noticed that our drinking water was corroding their car engine parts. Like, even when I say that today, like my jaw still drops. Our drinking water was corroding car engine parts, and General Motors was allowed to go back to Great Lakes water. And the people of Flint, who were loud, who were organized, who knew something was wrong, they were all told to relax, that everything was okay, that everything was in compliance. There was nothing wrong with this water. And it turned out that the water was missing this really, really important, necessary ingredient called corrosion control. And without that ingredient, it was about 20 times more corrosive than the water that we had been getting from the Great Lakes. And I, by pure serendipity, found out about this lack of corrosion control from a high school girlfriend. She was at my house. She had just moved back to Michigan. We were both did a lot of environmental activism in high school, and I went on to do environmental health and medicine, and she went on to be a water engineer, and she worked at the EPA, the Environmental Protection Agency, and she was in DC and worked for public water utilities, and she had just come back to Michigan. So we were hanging out, and this was kind of late summer 2015. And I texted her literally just a couple hours before. I'm like, hey, you're back in town, come over. My husband's gonna barbecue. My husband's obsessed with barbecuing. He's like, come over, he's gonna barbecue, it'll be great to see you and the kids. And she comes over and she's like, hey Mona, you're in Flint? Like, I'm like, yeah. She's like, well, what about the water? I'm like, yeah, there's some like local reports. People seem concerned, but everybody in charge, every scientist, everybody in the state says everything's okay. And she's like, but Mona, I just saw a memo from a former colleague of mine at the EPA. And she's like, I trust him, I know him. And he says that Flint's not using corrosion control. And she stares at me like I'm supposed to know what corrosion control means. Like, I didn't learn that in medical school. And I'm like, okay, so like what's corrosion control? She's like, well, it's this federally necessary ingredient. And if it's not in the water, then the pipes are gonna corrode. I'm like, okay. She's like, well, the pipes are made of lead. And that's the exact moment that my life changed when I heard about the possibility that there was lead in the water. Because I respect the science of what lead does. You guys tell me, what does lead do? It's a neurotoxin. What else? What's that? Yeah, so it affects the brain development of young children. So it's especially potent to developing brains. So kids, little kids. What are the consequences of lead poisoning? What happens to kids who are exposed to lead? So it reduces connections in neurons, and so kids present with what? Learning disorders. What else? Headaches. So lots of different problems. So it impacts cognition, so learning problems. It actually lowers IQ levels. It impacts behavior, leading to things like developmental delays, attention problems, focusing problems, other health conditions like hearing loss, growth disturbances. Lead exposure has also been linked to like oppositional defiant behavior and violent behavior and even criminality. We know that kids exposed to lead as adults will manifest with things like high blood pressure and kidney disease and gout. Lead exposure is actually one of the leading causes of cardiovascular disease. And early lead exposure can also present later on in older folks with things like early dementia and Alzheimer's. So it has a lot of bad consequences as this neurotoxin. And incredible science has taught us, especially over the last few decades, that levels that we thought were okay a while ago in our bodies, we now know are no longer okay. What did we used to put lead in? What will you guys tell me? Awesome, we put it in gasoline. Who put it in gasoline? General Motors. Okay, so they're a big character in the story. So we put lead in gasoline. We put lead in what else? Paint. We put lead in paint because it made colors brighter and it lasted longer and it didn't get damaged. What else did we put lead in? Pipes. We put lead in the pipes. Okay, chemistry students, what's the elemental symbol for PB? Oh, I just gave it away. Sorry. So the elemental symbol for lead is PB, which in Latin means plumbum. So lead actually means plumbing. Like I didn't even know that before all this. So plumbing. The Romans put lead in plumbing. And one of the theories for the demise of the Roman Empire, and there's many, that they used a lot of lead in their plumbing and their aqueduct system, but they also put like lead in their food as salts, because lead is sweet. But that we digress. So we put lead a lot in paint. We put lead in gasoline. We put lead in plumbing. What do we still use lead in? Car batteries, which is a big issue right now with the electric batteries. What else? Gasoline, we use lead in especially aviation gasoline. So in the planes, a lot of that is leaded gasoline still. What else? What's gonna open up here in a week or so with all the deer? Bullets. So there's lead in bullets. I've cared for children with lead poisoning because they were shot and they still have retained bullet fragments in their bodies that keep leaching lead. Fishing tackle, it's still in like foreign makeup and toys and window blinds. Like it's still in lots of bizarre things. So even though we finally passed great laws to restrict the use of lead in paint, plumbing, and gasoline, it took too long. When the rest of the world stopped using the lead is when America said, let's put lead in everything. And that's when they put it in paint, plumbing, and gasoline. And the Lead Industry Association, I could talk about them for an hour. They were a very powerful lobbying group. They manipulated regulations. They went after scientists. They went after the victims of lead poisoning, and often with very racist tactics. But they profited and are an industry that has created a public health disaster that has yet to be held accountable. So unlike like tobacco and asbestos and even the opioid industry for a little bit, but not enough, there's been some efforts at accountability, but the lead industry has yet to pay for really kind of decades and decades of the harm that they knowingly have caused, especially some of our most vulnerable populations. So when I heard about lead, I knew that science. I'm like, I know lead's a poison. I know it's a neurotoxin. I know that now we recognize that there's no safe level of lead. Even when I was a resident taking care of kids with lead poisoning in Detroit, we used to think that there were some levels that were okay. But incredible science has taught us now that there is no safe level of lead. And that what we're supposed to do as a society is this public health practice called primary prevention, where we're never supposed to expose a population to lead because of what it can do. When I heard that word lead, I knew that science, but I also knew that lead, the burden of lead, like most environmental contaminations, doesn't fall equally on our nation's kids. So even 30 years ago, as an undergrad, lead was this classic example of environmental injustice or environmental racism. It is kids who are predominantly poor and predominantly of color that are disproportionately burdened by things like lead contamination. So those two things together, knowing the science of lead and then knowing its disparate burden, that it's kind of this root cause of inequities, this kind of decades-long failure of society to protect our most vulnerable children. That's what changed my life. That's when I stopped eating. I lived on coffee. I lost about 40 pounds. I stopped sleeping. And I went on this kind of quest to figure out what was happening. How could anybody sleep at night with the possibility that a neurotoxin was in drinking water? And so quickly conducted research, which was super easy research, to find out what was happening in the blood of our children. So as pediatricians, when kids come in for their checkups at the ages of 1 and 2, we actually screen them for lead in their blood. Not all kids, but most kids who used to be a universal thing, but now it's targeted. Kids on Medicaid, which is public insurance, kids who live in older homes. But most kids get screened for lead at the ages of 1 and 2. And it's recommended at those ages because that's when kids developmentally are walking and crawling, and they explore the world by putting everything in their mouth. So that's when they have a lot of hand to mouth activity. So that's when they're most at risk for like lead paint and lead dust and lead soil. So these household exposures. Lead in water impacts a slightly younger age group. And lead in water is also different than other sources of lead exposure because we need water to survive, right? Like it is a medical and public health necessity. And when you have lead in the water, it's literally in a vehicle that we're meant to ingest. Yeah, kids eat paint and dirt and all that stuff, but they must drink water. Especially think about those formula-fed babies. That's their whole diet, is this powder mixed with water at a period of their greatest neurodevelopmental vulnerability. That is when their brains are growing the most. So we screen kids at those ages, and I'm like, but like, I'm just like one doctor in one clinic. Like, I can't tell you like what's happening for all the kids. And I knew that these blood lead tests are part of surveillance programs. And surveillance is like basic public health. All these tests go to our local and state health department, and they can see what's happening at a population level. So medicine is very much kind of a one-on-one interaction, and public health addresses things at a population level. So I'm like, wait a minute, this is surveillance. Like, what's the data? Like, who has this data? And I tried to get that bigger data that was available, but nobody wanted to share that data with me. So realized fairly quickly that our hospital in Flint actually processes most of the labs for the surrounding community. And I know I have an Epic friend. Where's my Epic friend from Covenant? There we are. So we pulled medical records, and our medical record company is Epic that we use. Fortunately, our hospital had switched to the electronic system, so we were able to pull all these medical records and look at children's blood levels, obviously with the necessary protections in place when going through the IRB process. So anybody who's done any kind of research, you go through something called the Institutional Review Board to protect patients. So went through all these necessary steps fairly quickly to get access to this data. And I wanted to be wrong. I wanted my hypothesis to be wrong. Like, I don't want to see more lead in the kids. Like, I want to be proven wrong. Please don't come up, that there's more lead in the blood of our children. But it was kind of common sense. Like, there was so much lead in our water, like literally in the hundreds and thousands and tens of thousands of parts per billion. So let me give you kind of a little reference there. So the EPA has something called a maximum contaminant level goal for lead in water, which is set at 0 parts per billion. It's not enforceable though. Then they have an action level for like a community water system set at 15 parts per billion, which is not health-based. And then the American Academy of Pediatrics has a recommendation for lead in water for like schools and childcare facilities set at 1 part per billion. And we had lead levels, once again, in the hundreds and thousands of parts per billion. There's a home adjacent to Flint for like foster kids, and I think this was my lowest day. Their lead level in their sample was like 5,000 parts per billion. Like, this is like toxic waste levels of lead in the water. This lack of corrosion control was eating up our pipes. When the EPA finally came in, they said it was like you were drinking through lead-painted straws, and you never knew when a piece of lead was going to come off those pipes and into the drinking water and ultimately into the bodies of our children. So this is basic kind of science. So if anything, let this Flint story also serve as an example of what happens when we deny science, when we disrespect science, when we don't listen to scientists. Not only the science of water, but the science of lead and the voice of scientists as well. And that's also something that is resonant to where we are today. Did this research, found more lead. And for all the academics in the audience, what do you do when you publish? Or no, I keep answering my own question. What do you do when you do research? You publish. And if anybody's published anything or presented at conferences, it goes through this really important process called the peer review process. How long does that usually take? Months. It takes a really, really long time. So the kids in Flint didn't have a really long time. So I walked out of my clinic, and I stood up in our hospital conference room at a press conference and shared these findings, which was kind of an academic no-no. As Heidi mentioned, I've received all these really humbling accolades. And I think my favorite was an award I got from MIT, and it was called the Disobedience Award for being academically disobedient by not waiting to publish, by just sharing these research findings. Cute award, but very difficult to explain to my children when I came home. They're like, "What, Mom? You got a Disobedience Award? So I don't have to clean my room or do my homework?" So that was a little tough. So shared this research, and I felt awesome. I'm like, yay, I am sharing science, right? Like, can you guys imagine being in the middle of a public health crisis and science wasn't being listened to? Dun, 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 dun. That was a joke. So I was just sharing science, and I'm like, we're just protecting kids. Like, this is great. Like, this is part of my job as a pediatrician. I wear lots of hats. I'm an educator. I am a clinician. I'm a researcher, but I'm also an advocate. That's part of my job. That's why I went into medicine, is to be that advocate. So I was just, and I continue to be, just doing my job to protect kids. So I felt good for a little bit. And then I didn't, because then there was quite a bit of backlash. Just like everybody else in this story who'd raised any kind of red flags, the moms, the pastors, the activists, the journalists, the water scientists, I was also dismissed. My science, me as a professional, and I kind of knew that was going to happen, because like I said, everybody who'd said anything about this water was also dismissed. The amazing water scientist who came to Flint to test the water, like a MacArthur genius, like really smart guy, world expert. When he said that there was lead in the water, the folks at the state said he was a magician. He was pulling rabbits out of hats. And so when I shared this research, there was all these folks that were saying I was wrong. Once again, I tried to prepare myself. I even had a conversation with my brother, who, of all things, is he's a lawyer in Washington, D.C., and he's a labor lawyer, so he represents like unions and workers. And he's like, oh, Mona, what's going on at work? I'm like, yeah, I'm about to share this research, about blood levels, and there's this water problem. And he's like, Mona, he's like, you're a whistleblower. I'm like, I'm not a whistleblower. He's like, Mona, I'm a whistleblower lawyer. I'm like, look, I had no idea you were a whistleblower lawyer. And he's like, you're gonna get pushback. Like, folks are gonna go after you. Like, there's gonna be like intimidation and retaliation. I'm like, no, I'm just sharing science. Like, it's gonna be okay. It's gonna be great. So he was like trying to give me like big brother advice and like lawyer advice at the same time. But I think nothing can prepare you for when these really powerful forces go after you. And for a while, I felt defeated. Like, I felt tiny. Like, I'm already kind of tiny. Like, it felt tinier. I began to second guess myself. I'm like, oh my gosh, maybe I am wrong. Maybe the science is wrong. Like, maybe I did my research wrong. I think a lot of women also get this sense of like imposter syndrome, like, oh, maybe it shouldn't have been me, maybe somebody else should have done this, maybe like I'm not an expert on this, maybe I should have just kept my eyes closed and gone about my busy business as a pediatrician, educator, mom, wife. Like, maybe I shouldn't have done this. If you read my book, it's written in the first person, like I wanted you to kind of go through the roller coaster that I was going through, and I physically felt sick. Like, I had just gotten a Fitbit, like previous version of Apple Watch, and I could like quickly see my heart rate. Obviously, as a doctor, could get tell my heart rate, but like quickly see, and it's like it was approaching 200. Like, I was like physically shaking. I wanted to vomit. Like, that pressure is hard. It is hard to speak up. It is hard to do the right thing. Fortunately, I quickly realized that this wasn't so much about me. It wasn't all about me. This was not about Dr. Mona. This was about my kids, my Flint kids. They're my why. They are the reason that I went to school forever. They're the reason I wake up in the morning. They're the reason I'm here with you. They're the reason I wrote a book. They are what grounds me. And it was quickly recognizing that my research with all those numbers and spreadsheets and Excel, like every number wasn't just a number. Like, every number was actually a kid I'd probably even seen and cared for in the last year or so. And it was almost as if those kids like jumped out of my spreadsheets, lifted me up, and gave me the courage to keep going. So find your why. Especially those of us in health and service-driven fields. What is your why? And I hope your answer is the people that we are privileged to serve. It is not the power, it is not the paycheck, it is not the prestige, it is the people that we are privileged to serve. So I have made it almost a daily habit to ask myself my why, and I especially ask myself that why when I am down and when I feel defeated and when I am overwhelmed. I'm like, Mona, what's going on? What is your why? Why are you doing this? And the answer always comes back, the kids. So the kids lifted me up. It took a while, but it was our persistence, our science, our teamwork that literally spoke truth to power. The state eventually conceded, and since then we have been on a path towards recovery. I now direct this initiative in Flint. It's called the Pediatric Public Health Initiative, where we are throwing everything at our children, working hand in hand with so many wonderful community partners to mitigate the impact of this crisis and to serve as a national model. In Flint, we took a crisis and we have been trying to turn it into an opportunity to do better, especially on behalf of our kids. So I have this amazing kind of platform, microphone, that really has taken me beyond Flint, that has allowed me to make an impact in so many other communities with my amazing team to share our best practices. I'll give you one quick example. In Flint, we struggle with nutrition, and good nutrition is really important for brains to grow. And it's especially important when there's lead exposure, because lead eventually gets stored in your bones, and it can come out when there's poor nutrition later on. So nutrition is just really important. But in Flint, we don't have that many kind of places where people have affordable and healthy nutrition. So in my pediatric clinic, which sees the most kids in Flint, we actually moved our clinic to the second floor of the Flint Farmers Market. Has anybody been there? The Flint Farmers Market, awesome. It's so much fun. It's a super, super cool place. It was just ranked one of the top farmers markets in the country. We beat Seattle, amazing. Come Tuesdays, Thursday, and Saturday. They're not paying me. Okay, so come to the farmers market. So we moved our clinic atop a farmers market because I used to tell my patients before we moved, you need to eat healthier. You need to eat things like avocados and kale. And they would just stare at me where am I going to get avocados and kale? And how am I going to afford that? So we co-located with the farmers market, and every kid that comes in on Epic, or electronic medical record, just like we were prescribing amoxicillin, an antibiotic, we prescribe fruits and vegetables. And because of amazing grants, it has a $15 value, and they fill that in our farmers market. And I work with an amazing team of folks that are totally smarter than me. Just try to surround yourself with folks that are smarter than you. I have worked with public health nutritionists. I'm from MSU, and we've been analyzing this program. Does it work as academics? Does it improve things like nutrition security and education, behavior, and BMI, and all these really important things? And we've published quite a few papers. And one of our US senators, Debbie Stabenow, is really prominent on agriculture committees, as you probably know, and she actually was the co-sponsor of the US Farm Bill. So this is the national bill about food and agriculture. And she's been to our clinic, and she knows about our program, and she has been instrumental in our recovery. And she's like, this is a great thing. You guys have this amazing evidence. So she put a nutrition prescription program in the US Farm Bill. So now it's this $25 million USDA national program to help communities all over. It's not enough, but it's amazing. So that's just kind of one example of how we've transformed practice into policy, but also how we are trying to help kids way beyond Flint. I'll give you one more example real quick, and hopefully we got to the point of kind of opening up to questions. A few months ago, I had the amazing privilege to once again testify before Congress. Congressman Kildee, who's your representative as well, has been and continues to be an amazing champion. And he serves on the House Ways and Means Committee in DC. And they were holding a hearing about the National Infrastructure Bill. Hopefully you guys are paying attention to the news. This is something that maybe will it be imminently passing? Who knows what happens in DC? But part of that national infrastructure bill is money to invest in roads and bridges and broadband and ports, but also water infrastructure. So included in that bill, because of our advocacy, is the plan to replace all the lead pipes in the whole country. And he had me testify about why this is so important, why, once again, this is not just about one city over there, but it's about kids everywhere and how we have to do better. A few examples of kind of the ripple effects of our work. And as we kind of find ourselves in this kind of generation-defining moment of crisis. So we're all kind of in the midst of another public health crisis, right? And I mentioned earlier, some folks who've read my book recently, they're like, oh my gosh, did you know that there was gonna be a pandemic when you wrote this book? I didn't. But they're like, yeah, there's some of the same lessons. And it's a lesson of good governance and the importance of public health. It's about respecting science. It's about investing in public health infrastructure, which is what keeps people healthy, rather than taking care of them once they're sick. And it's also about inequities and disparities. So I am hopeful that the nation will try to do kind of what we've been trying to do in Flint. Once again, we took a crisis and turned it into an opportunity. We are at a moment together now where we're kind of in the same sort of lessons that we can also transform from a crisis into an opportunity to do better, so that the life expectancy of so many of our nation's children isn't dependent on things like zip code or color of skin or state of birth or country of origin or school district or water source, that we can truly address some of these kind of underlying inequities that make people sick. So I am hopeful. I'm an eternal optimist. I'm always excited. I'm hopeful. But I am hopeful that we can finally learn the lessons of Flint, which are now national lessons, and do better on behalf of all children. So thank you for having me. I am so excited for your questions. And I talked way too long. Where's Heidi? She's here somewhere. All right, Heidi.
Yeah.
Thank you. You got that. Thank you.
Thank you. We said this earlier, we had a dinner, and I said to Dr. Mona, not only are you my hero, you are our hero. You did something that was incredibly uncomfortable when many people probably would have said, no, perhaps I don't know what I'm talking about. So on behalf of an incredibly grateful community, but also an incredibly grateful state, we thank you for the work that you do.
Thank you.
Thank you. We have a couple questions that have come in live, but we also have two of my colleagues from Michigan State's College of Human Medicine that are in the audience with some microphones. So we welcome, why don't we go, because I can't see anybody, we're going to go Paula, Julie, and then I'll go live for virtual. So Dr. Close.
Sure. We have one question here.
Well, thank you. Mark Edwards, who I met with a few months ago, described you as the heroine of Flint, as the person who stood up to so many things with science and so forth. And I think you realized you had an incredible impact on the whole country. And so we thank you.
Thank you.
We're very grateful. I'm Dr. Ziggy Kazicki. I'm from the University of Detroit, and I'm working on getting a water center in the Great Lakes. But I'm wondering, what is your thought about a water quality index? We have an air quality index. Wouldn't that help with primary public health if we actually had measurements coming in from thousands of different sources around the state, telemetry information going to a center like here? We could have a data center here at Saginaw Valley State University, compiling all this information, sending it out to primary care physicians, telling you what is the quality of your water in your community on a daily basis.
Yeah.
How do you think that would have impacted what happened in Flint?
Yeah, that's a great question. So about kind of telemetry and transparency of data. So any transparency would have been a really big deal. And water, I've learned a lot, and you probably know more than I do, but water chemistry is an art. Water treatment is an art. You can sample a same house 10 times and you could get 10 different results. It could depend on time of day and time of year and the temperature and the speed of the faucet, and if you took out the aerator at the end of the faucet, like there's a lot of nuances to water sampling. One home could have problems and the home right next to it may not have problems. So it's, I think, really important for a lot of this to be like address-based. We need more transparency in water quality. We assume that when we turn on our tap, and I assume that it's safe, but it's not. Our laws are weak. They are absolutely weak. They were never intended for us to have lead-free water. The lead and copper rule at the national level is a joke. It's trying to be updated. Michigan actually adopted a model lead and copper rule, but it's still not enough. We don't function on this premise of primary prevention when it comes to water, and we leave people blind. People don't, like, when my babies were little, we lived in a house built in the 1940s, and when I was making them noodles, I would use hot water from the tap because it boiled the noodles faster. Like, you're never supposed to do that. Like, for sure I probably had a lead pipe, but you're never supposed to use hot water from the tap, but nobody knows that. Nobody knows basic kind of what you can do in your water. Some states, for example, at the point of home transfer, when you're buying a house, they'll do a real inspection and tell you what kind of pipe you have. Like, wouldn't that be really important for all of us to know these kind of things? So yes, we need to know real-time data, not data that's been looked at 4 years later. And that also speaks to our chronic disinvestment in public health infrastructure. I can go on forever, but many of the investigations that came out after Flint really looked at the kind of these bureaucracies at the state level and said that they have been victims of austerity. Like, for decades, they've been under attack, these kind of attacks on big government that had left them really just reactive, like responding to crises in very minimal ways rather than proactive. So we have to invest in public health infrastructure, and water delivery is part of that. We have to update our monitoring and our surveillance system, something the pandemic has also taught us, that public health surveillance is outdated, antiquated, from who's gotten vaccines or where the cases are, and we rely on like universities to do that. So yes, great idea. We need to do a lot more to get real-time preventative data so that patients or people know, because right now people don't know what the status of their water is, and that's not just for lead. There's PFAS and all these other things that we don't know about, and a lot of this is purposeful. We were kind of meant to be kept blind. It's one of the reasons my book is called What the Eyes Don't See. There's an assumption by especially public water utilities, oh, everything's fine, everything's okay. And folks are often driven by profit rather than public health.
Hello, Dr. Mona. We had a group of our students at SVSU do a little research project before the pandemic. And we went to North Front in an area that was very impoverished, mostly African American, and they did a little survey. And they asked about how people were coping with the aftermath. And we found that there was worries about children and grandchildren, worries they can't sell their house, they have no retirement now. But also, we asked them, who do you trust as far as health, your health, and who can tell you what water to drink? And they still said, we don't trust the government, we don't trust the leaders of our community, and then we found out they don't even trust their doctors anymore. They've lost trust.
Yeah.
So my question is, in the aftermath, how do we help them? Because that's going to be part of the recovery.
Yeah, and that's why this is also a resonant story to where we are, because so many folks in this country don't know who to trust, and are victims of misinformation, and kind of that's a little bit of what was going on in Flint. Everybody was told the water was safe by folks who were supposed to keep you safe, and they were being told the water was safe when it wasn't. And that lost trust didn't just happen with the water crisis. We went through Flint's history. There's been decades of lost trust. And for some folks in Flint, when the water crisis happened, they're like, see, this is a genocide. They want to get rid of us. This was purposeful. So that rebuilding that trust, it will take a long, long time. It will take long-term commitment. It will take resources. It will take transparency. It will take truth and accountability and justice, which are still ongoing. And it will take a long-term commitment. I was at at a conference of philosophers, which was fascinating, and the trust question came up, and someone's like, well, how do you rebuild trust? And some really smart philosophers like, well, don't you think it's important to always have a healthy dose of mistrust? And I'm like, yeah, I think so. Like, I wish I had a healthy dose of mistrust in the beginning of the crisis, and I wouldn't have told my patients that the water was okay. So I think all of us, no matter, should hold on. We should never blindly trust. We should be curious, and we should ask questions, and we should see more data and hold folks accountable. So we should all have a, not paranoid level, but a little bit of a blind mistrust, or a little bit of mistrust.
We have a question that came in. We have about 300 people who are joining us virtually to give you an idea of
Hi,
how many are
everybody.
there. This question actually comes in from Linda Tracy Stevens, and I say that because many of my students have a relationship with Hurley and the Children's Miracle Network and raise funds for that every year. And Linda serves as the director of CMN. And she says, Dr. Mona, what was the lowest moment for you during this process, and how did you deal with that? And how did all of this impact your family?
Oh, Linda's the best. I love you, Linda, out there in the virtual world. So I think the lowest moment was kind of when the state went after me. Like, it was really, really hard. And like I said, I felt defeated. Like, who am I? Like, I'm just like this barely 5 foot tall, brown, first generation immigrant woman, no less, like going against these like really powerful forces in the state. And I think that was the hardest thing. And once again, what kept me going is the quick realization that this is not about you. This is about the kids. So my family, my personal family, they are fine. I was absent for a long time, but they were still kind of loved and cared for. This is also a story. I put a lot of the personal in my book. I talk about, missing Girl Scout meetings and soccer and not caring for a husband who was sick. And I put all that personal in there, especially for young women who are trying to be professionals and trying to achieve this balance, which is really hard because sometimes family's here and work is here, and sometimes work is here and family's here. It's rarely kind of this steady line. But I put that all in there to share that, like, I'm not this like hero. I am just like you. I am trying to juggle all these balls in the air. And if I can do this, then you can do this too. And for me, it was also achievable because I was surrounded by a village, and I think that's a big part of this story. And one of the reasons I did not want to write a book, because I'm like, this is not a story about one person. This is a story about a team. Like, Mark Edwards is like, there's so many, the people of Flint, like, this is a story about a team that came together, an unexpected team, folks from different disciplines and backgrounds and ideologies who all had this common purpose and refused to accept the status quo. So find your village, find your team. I have a team at work, and I have a team at home. Like, some of the texts I was getting right now was like the babysitter picking up my kids and all these other things. So you gotta, it is hard to find that balance. So surround yourself with a village.
Thank you.
So you talked a bit about like giving your the Flint children and people vegetables and fruits, and that's treating the effects of Flint poisoning. Are there other things that you can do that would be treatment for the Flint poisoning?
Oh, that's a great question. So there's not like a treatment, like I wish there was. Like, I wish that there was something I could prescribe that could take it away or reverse it, like an antidote or a magic pill. That doesn't really exist. But there's a lot that science tells us can help kids. That is based on evidence. So we know that good food is important for brains to grow. And we know that kids need access to a doctor. And we know that they need high quality education and all these different things. So we're doing all these other things that science tells us helps children. So in Flint, we have, for example, 2 brand new child care centers, a massive expansion of early literacy and home visiting programs and breastfeeding and parenting support and trauma-informed care and mental health care and Medicaid expansion. The list goes on and on of this awesome. And you're probably like, wow, that's so cool. That's really cool stuff. But it's not. These are things that all kids need. These are basic fundamental things that all kids need to be healthy and successful. They need food. They need, education. They need stable homes. They need access to a doctor. So, these are kind of the ripple effects of what we're trying to share. I had the privilege of writing an article for the New York Times called The America We Need. And it was like, hey, it was like almost a year ago, and it was about post-pandemic America. How do we build an America that's more fair, more just, and more resilient? And my article was called, I'm sick of asking children to be resilient. So too often we burden kids who've already gone through so much with more, like read more and eat better and clean your house and do all these different things, where really as a society, we have to build resilient communities. We have to do more as a society and invest in what keeps people healthy. And that's not always in the domain of health care. So keeping people healthy are things like raising the minimum wage and like free childcare and stronger environmental regulations and healthcare that's not tethered to employment. Like these are the things that fundamentally also keep people healthy, which we don't do a good job doing.
Do we have another question from the audience on this side, Julie?
Hi, thank you. We're from Holly, 20 minutes south of Flint. We met you at the Whiting when Michael Moore had a screening. You said if we ever came up with some numbers, you would take a look. We now know we have an MPART site and a 2-on-1 facility right next to both of our houses. The runoff that's being created by land development adjacent to it is the word they like is exacerbating it. It is now under standing water. So the state has just asked for $300,000 to completely, or to get a better handle on how bad this is. But there's about 200 new families about to live right adjacent to it. It's discharging into the Shiawassee. They have current compliance letter, including non-reporting. We have a bunch of documents if you're interested in taking a peek. But the state is failing us, and we're very frustrated. We've been doing this for 4 years, and 100,000 people's drinking water is at risk in Lapeer, Genesee, and Oakland County, and there is no backup water supply.
Yeah. We'll connect, and I think this reiterates that this is not some random one story. This is a story everywhere, including throughout our state. If you've paid attention to the news, especially over the last week or so, there's an issue in Benton Harbor, Michigan, a very similar issue. But there's a lot of contaminants that we don't even regulate. PFAS, finally the federal government is starting to kind of look at what action levels are. It's still being used. It's this like flame retardant. It's a forever chemical. It causes cancer and endocrine hormone problems. So we're still not being governed by primary prevention. We're not doing what's best for public health, and industries continue to have the upper hand to make profits. So how do we fix this? We vote, we get civically engaged, we write letters, we press every single button that we can press to make sure that these things don't happen, but we can connect afterwards too.
Number of questions coming in is asking that exact thing about what's happening in Benton Harbor and what are we failing to learn. We've got more questions coming in about the children today. What are you noticing? What are you seeing in the children this many years later?
Yeah, that's a great question. So we have been fortunate to be supported by the CDC, the Centers for Disease Control, to launch something called the Flint Registry. So the Flint Registry is this massive effort to see how people are doing fundamentally. So people complete, it's voluntary because they have no trust. So they complete a survey. We work hand in hand with the community. All of our work is done in humble, shoulder-to-shoulder partnership with the community, and that's absolutely how you do public health and medicine. So we're 20,000 people have already enrolled in the survey. It's not research. It's all about getting people connected to those awesome things I talked about. They complete a survey and they could qualify for lead pipe replacement or lead inspection or early enrichments for their children or healthcare access. And we're starting to kind of garner the data from that. And what we are finding is that, yes, there's ongoing issues with stress and trust and anxiety and fear. And just those feelings in and of themselves can also lead to poor outcomes, which is why we holistically have framed this crisis as a trauma. Like, this is a trauma, a city that went through a trauma on top of so many other bad things that were already happening kind of in the city. So we're really, really leaning on the science of trauma and how to be trauma informed in our response. So yeah, the ongoing issues and the silver lining, once again, I'm a silver lining person. So we had built this public health infrastructure to support folks. And then the pandemic happened. And what did people need in the pandemic? They needed healthcare healthcare access and emergency food, and they needed, mental health care and stuff like that. So the registry was quickly leveraged to help people also in the pandemic. So it really speaks to the value of being kind of preventative and investing in public health. But it's long-term work. We talked about the science of lead, the manifestations we may not see for decades later. So this is work that we hope to continue for decades.
I want to be respectful of everybody's time. I think we could stay a long time.
I could talk for hours.
Exactly.
But my kids would kill me.
Right. And we want to make sure. Do we have another question here in the audience? And then we're going to start to wrap things up and being respectful.
Hi, my name is Kelly. Thank you, Dr. Mona, for being here. I really respect your ability to say, your passion and, how you never take no for an answer. I'm an ER nurse. I take a lot of pride in taking care of the community through the work that I do. I do a lot of volunteer work with remote area medical, so we do free dental, medical, and vision in high-need areas and healthcare deserts. And I'd love to bring a clinic to Flint, so let's connect later. But in seeing the parallels with Flint and rural Virginia, we have people that have ERs that are closing and they have to drive like 3 or 4 hours. And my question to you is, how do we how do we restore confidence in a system that wasn't built for the people?
That's a great question. So how do we restore confidence in a healthcare system that wasn't built for people? And you're right, our healthcare system wasn't built for health. Health and healthcare are very different things. The system that we have right now, known as healthcare, is predominantly a sickness-based system, and it's very profit-driven. There's corporations that make money when people are sick, and the system that keeps people healthy is by and large kind of this public health system that we have grossly underfunded and undervalued. And if you compare us to kind of any other industrialized country, we spend the most on health care, and we probably spend the least on health, and we have some of the worst health outcomes because of that. So how do we fix this, right? Like, how do we start investing in health? And once again, what keeps people healthy? And those are the things that we talked about. Those are things like stronger environmental regulations, raise minimum wage, better investments in our schools, all these things that aren't in the domains of like healthcare, but truly impact health. So we keep talking about it. We talk to our policymakers about it. We advocate for, we vote for folks who want to increase funding for public health and support these kind of measures. So there's things that we can do. For example, right now, like the child tax credit is the great example. It was this temporary tax credit that has lifted millions and millions of children out of poverty. It's about to end, and it might not get renewed. It's part of kind of Biden's Build Back Better plan. Everything that we do in Flint are Band-Aids. Like I often say, I wish I could prescribe living wage jobs for parents to lift them out of poverty. We have a near 70% rate of child poverty. Like all the things that we see are often kind of manifestations of childhood poverty. Like we know childhood poverty actually makes brains smaller. So those are the kinds of things that we need to be investing in, are these root cause kind of determinants that make people healthy. So call your legislator. Congressman Kildee, he supports it. So do your 2 U.S. senators. But call other legislators. Tell them you want this child tax credit to be permanent because you want kids not to grow up in poverty so that they have opportunity. So these are the things that we can do to kind of shift that dynamic.
Do you have time? Can I give you one more question?
One more question.
Okay. And the reason I want to do this last question is when Dr. Mona agreed to come to Saginaw Valley in 2020, and then we postponed it to come now, her big thing to me was, I want to speak to the students. I want to speak to the future healthcare providers. They are the next generation. They've got to pick up this torch and keep things going. And I love that a question has come in from a former Saginaw Valley student, now an alum, Dr. Manuel Avellino, who is a second-year internal medicine pediatric resident. Mm-hmm. And he says, thank you for your inspiring story. But are there any advices you can offer to current and future healthcare professionals in promoting environmental justice and equity? So here's your platform, and here's the group you wanted to address.
Awesome. So I am going to leave you with something that I've called my 4 Ps. So it's kind of cheesy, but these are my 4 Ps. So, and please know that when I do these kind of events and when I'm here with you, like this is not, it's not about me giving you anything. It's about like you, especially the young people, inspiring me. I have this amazing privilege also as kind of being this author of this crazy book that I get to hang out with college students and grad students and high school students all the time. And I come away from these events like giddy with hope and inspiration. It is your generation of young people especially that have stood up for things that nobody has stood up for before as well, and you're making change, be it justice or democracy or equality, finally tackling big issues like racism and the climate crisis and democracy and women's rights and all these different things. So please know you guys inspire me, and I'm grateful to be here and have this opportunity. But I will leave you with my 4 Ps, and the first one is find your passion. And what I have found with young people, especially today, is you care so much. And sometimes it's overwhelming. There are so many issues to care about right now. There's a lot of stuff going on, and it can be absolutely overwhelming. So find your passion. Like, what is the thing that keeps you up at night, that you care about? Is it water or immigration or the climate crisis or whatever, healthcare for all? Like, what is your thing? So find your passion. That's the first P. And the second thing that I would recommend is, and we touched on this earlier, is find your people, find your peeps. This work is hard. There are going to be moments when you are on the floor and you need your people, your peeps to lift you up, and vice versa. This is a team sport. So find your people. So find your passion, find your peeps, be persistent. I think that is definitely one of my stories. We do not give up, especially if you want to create change. Change happens in windows, and you never know when that window is going to open. And I'm not just talking about big change like the child tax credit or getting the lead out of the pipes. I'm talking about little change here on your campus. Like you want to fix parking or the cafeteria or whatever. Like, and you've been lobbying for it and advocating for it or whatever. And there'll be a moment that you talk with the administrator, they'll be like, okay, fine, yes. They like you were so persistent. They said yes. So be persistent, because change happens in windows and opportunities. So find your passion, find your people, be persistent. And the last thing that I would recommend is be prepared. There's a line in my book that says something like, I was the right person at the right time with the right team, but also the right training. And a lot of that came from my time as an undergrad, from a med student, where I developed these kind of foundational skills in research and data, but also in public speaking and service learning. I did a lot of things like alternative spring break trips and different fundraisers. I took literature classes. I stayed another year in college to take creative writing because I thought I'd never be able to write again. Only when you kind of look back on your life are you able to connect these dots. And you're like, oh my gosh, that thing I did that one time, that when I organized that fundraiser for whatever, like I need, those are skills I need now to organize this. So take advantage of the incredible opportunities that you have at this amazing university. Coming to random talks like this, or being part of a research project, or going on a service trip, or doing any kind of public speaking. And I know that makes people queasy, but the more you do it, then it's easy. Or talking to policymakers. The more opportunities you have to do these things, the easier it gets. It's all about practice. In medicine, we know practice. We talk about the 1,000 hours. We even do like simulations, like, we practice doing things like lumbar punctures and whatever, and then we can do it. And then we're teaching other people how to do it. So there's a lot of practice in all of this to be prepared. So I think those are my 4 Ps I will leave you. And kind of, especially for those who go into healthcare, a lot of people ask me like, I want to be a doctor, should I work in the hospital or do my research? And what I would kind of reiterate is try to get as kind of well-rounded an education as possible. You guys heard me talk. I was talking about history and economics, and I was talking about race and all these different things. To tackle the problems that are in our society, we have to be as well-rounded as possible. So that's, and if it's, if you're already in medical school, then read literature. I think that's one of the best ways that we can truly step into kind of the shoes of others and develop critical skills like empathy.
Wonderful, thank you. The praise is coming in through the virtual, and if you would all join me in thanking Dr. Mona for not only her talk tonight, but for what she has done for the city of Flint.
Thank you. Thank you. Thank you, thank you, thank you, thank you. Thank you, everybody.
And I know at one point we had talked about a book signing, and unfortunately we have just chosen not to do that out of respect for all and with the pandemic and trying to maintain as much social distance as possible. So we thank you for coming to campus. We are thrilled that we are back and offering some live events on campus, and we could not have chosen a better advocate, a better individual, a better role model to cap it off. So thank you.
Thanks, guys.
Safe travels.
Thank you.